Hey guys, it's Fertility Talks, and it's, well, no, I'm Mary Wong. I don't get this right every time, I don't know why. But I'm here with Melanie Mitchell, and last time we did a post, and it was live post number 114, and talking about how to do injectables for your IUI, IVF appropriately. And today we're actually going to do the real live thing. So we'll get started, but before we do so, let's tell everyone who you are.
So my name is Melanie Mitchell, and I am the founder, owner of Your IVF Nurse. I do have lots of experience working in fertility clinics, as Mary is aware. Many of you, I always get people coming up to me saying, "Oh my God, you're that nurse." When I'm in the fertility clinics, because I do visits to other clinics just to hand out information and talk to the nurses. So what I'm going to do is go through the injections that you'll commonly do. So I do have a pen. I also have, the pens are usually FSH, and you will know them as Gonal F, Puregon, or new one called Recavell. Each one you want to follow their manufacturer. I brought the simplest one. It's a Gonal F pen. It's preloaded, so if we were to open it up, you get it in a box that comes with needles, and you'll end up with tons of these needles no matter what pen you're using. And when you open it up, it's actually already pre-filled. So what you want to do is dial your dose. So if we were doing, what dose do you want to do today, Mary?
So I am literally being your victim, all for the greater good, just so you know. But she's not really going to inject the drug.
I'm going to poke, but I won't inject. Yeah. But I'll explain
real
how
poke,
you're going to.
But no injection for me.
Yeah, so we'll do 50 units.
Yes.
Okay, so you do want to follow your instructions from your clinic as per your dose, because every person's dose is going to be a little bit different based on your diagnosis. So what we're going to do is, when you're dialing your dose, you're actually on the Gonal F pen, you're turning it away from you, and it goes in increments of 12.5. So each pen is designed that every click that you kind of hear is a certain amount. So when you're dialing your dose, you want to make sure that they have a window. All the pens have a window that you can see. I don't know if I can.
Camera's up here.
Right there. There's a bit of a shadow, but that's your window that's going to indicate your dose that you've dialed to. You'll follow your instructions. If you over dial, the Gonal F pen is actually easy, where you just kind of, if you over dial, you just dial it back to your dose. So we've got the 50 units in here. I'm going to take an alcohol swab. You always want to clean the tip of your pen where you're going to attach the needle, and then new needle every time. And you just peel off that seal, and the needles on all the pens will just screw on until you get resistance. One thing I'm going to do as well, I have a little bit of hand sanitizer here before I touch Mary.
Just to make your hands really
Clean.
Cold. Clean
but
and cold.
I'm rubbing them, so it's going to be warm.
That's okay. The cold might be numbing.
That's true, and that's one of the things some people will do, is put something cold, as I mentioned in the previous video, on their tummy or in the injection area, just to kind of numb the area. So that's an option. I actually had a client not too long ago that literally pinched the area, and that in itself gave it kind of a numbing effect for her. So she was pinching the area
for a while.
Yeah. While I was mixing it, and it doesn't take me long to mix meds, but she was pinching, and then I said, okay, stop, because you're going to bruise yourself. But that worked for her. So that was a new technique that I kind of thought, that's interesting. Yeah. Okay. All right, so these pens, they always have, or when you put the needles on the pens, they have two caps. So remove the large one, remove the inner cap and the smaller one. And then this is an injection that's subcutaneous, so going into the tummy or thigh. If your clinic only recommends the tummy, do the tummy. If they give you the option of tummy and thigh, we're going to do Mary's tummy today. So you want to go.
Let's show everybody.
Okay. So belly button, 2 to 3 fingers on the outside. So from this area here, and what we want to do is just clean. And you can go here. I hear going right here is really, really sensitive. So we can go here, pinch.
So that's like 4 o'clock or something. Oh, well,
no, it's like, this would be 6 o'clock, 7 o'clock, 8 o'clock, between 8 and 9
o'clock. Oh, but it's because I'm looking here, which is a reference.
Oh, yeah.
Anyway, it's on either side, so it works either way, right?
So what I'm going to do is just tell Mary to take a big breath in, and then at this point, you would press the back end of the button, and you push this, and it injects the medication into you. And then once you're done and you can't push anymore, you wait like 5 seconds. So there's nothing going into Mary right now because I haven't pushed it. You wait 5 seconds, 1, 2, 3, 4, 5, and then you're just going to pull out, and then you're going to press. Now, if you're on baby aspirin, you're going to find that if you push really hard in your injection sites, you're going to get bruises the size of your fingertips. So if you're on ASA or Lovenox, depending on your prescription, or heparin, any blood thinner, you want to just gently press to minimize any bleeding that you're having.
Yeah, of course.
But,
and it is very light, by the way. It's very like she's just literally touching it to, I don't really feel any pressure.
Yeah.
So that's good to know.
Yeah.
Okay, so how about the insertion itself? Because you did a freaking awesome job. And for those watching at home, they've never needled in their lives.
Yeah.
So what's your... Well, that's my cat, by the way. Sorry, guys.
So the technique for the actual stick into you, when you're going in, and if you're pressing the skin, if you've got enough, and Mary has enough, I could do this on myself and I'd have plenty, but you could go actually straight in. If you're someone who doesn't have a lot of body fat, then what's going to happen is that you're going to go in like on a 45-degree angle, just so that you can get it in, because what happens is that you're not gonna, people are always fearful they're gonna hit something in their abdomen. You won't, but it's just easier if you have little body fat to go in on a 45-degree angle, but if you've got enough to get a good pinch, then you're going to just go straight in.
Okay.
Yeah.
All right.
And like a dart. Quick like a dart.
Exactly. That's what I always say, like a dart, and so that you don't back up either.
No.
Right?
And if you find that you have someone doing injections for you, then I've always told patients you're either sitting, because that prevents you from stepping back, or some people prefer to stand for their injections, so I'll actually make them stand against the wall so they can't back up in, like back away from
back away from the needle.
Yeah.
Oh, yeah, that would be bad.
Yeah, especially when you do progesterone.
Yeah. Yeah.
Yeah.
Okay, and we're going to get to that. That's going to be a fun one.
Yeah. Removing the needle. So some clinics will actually provide you with a little disposal kit. If you do not have, you want to use the larger cap, and then just carefully recap, unscrew, and then your used needle is going to go into your medical waste bag, which should come with your supplies. And then you're going to store your pen as per your clinic instructions.
Right, because again, that one, it's a dial-up, so you're going to have leftover dosing.
Yes.
Whereas some of the other ones, you have to mix and you just use a whole dose at once.
Yeah.
Which is what we're going to do
We're going to do next.
All
right. Okay. Now, we're going to do this one here. We're just going to say that it is a combination of possibly FSH and LH. There are different manufacturers, so doctors will have their preferences. But this is a powder, and you get sterile diluent or sterile water to mix the powder, okay? Now, the supplies that you're going to need are your needles that may come with a 3 ml syringe and a large needle for mixing, and then your small needle for the injection itself. Sometimes clinics will provide what's called Q caps, which will replace the larger needle on this syringe. So you may end up with just your syringes, a Q cap, and then a needle for the injection. But we're going to do it kind of old school with a needle.
Yeah.
Okay. Now,
I think I did the Q cap, just because it's easier for self-administration, right?
it prevents needle stick injuries.
Oh.
That's the purpose
That's it.
behind
That's the
it.
only reason.
So you don't poke yourself.
Okay, fine.
Yeah, but that's it. I won't say what I think about Q caps.
All right. But now we know
But-
already.
So your syringe and needle, your FSH or FSH-LH combinations, or LH I should say.
Oops.
So
That's just a cap.
these
I'll grab
caps
that.
literally just flip off.
Okay.
And then what you're going to do is start with your water, okay?
Okay.
And then
Yeah, I'll hold it
depending
for you.
on your dose, usually for your LH component, you mix up to, say, 6 powder vials. So 6 of these can be mixed into 1 cc or 1 ml of your sterile diluent or water. So big needle going in. This could be replaced with a Q cap that's going in. We're going to invert it, so completely straight upside down, not like this, straight upside down.
Just suck out the water.
Suck out the water.
So you're pulling on the syringe.
And then you're going to see that if I let go, the plunger will slowly draw up because there's a vacuum seal in here. So it draws the plunger back up. So you want to hold it at the 1, and that's regardless of if you use a Q cap or not. Hold it at the 1, take this off. The extra water you're not going to need because they always give you a little bit extra. You're going to take your 1 cc using your Q cap or your large needle going into your powder vial. So usually what I do is, that's my daughter.
Oh.
Usually what I do is, this will be done on a flat surface. So going in and you're injecting all the water, the 1 cc of water into your LH. Okay?
Yeah, in the powder.
And
then look how quickly it just completely
It pretty much dissolves right away. You don't want to shake it. Shaking it will make more bubbles. So a lot of times they'll just say swirl it like this, or even if you just let it sit, you should be good in a few seconds. What's going to happen is once you've got it completely dissolved, if you've got your Q cap or even your needle on your syringe, you're going to take everything out from here. So your 1 cc. Right. So that would be, say, 75 units because the way that the LH is that you're going to have 75 units of powder in here, so you need to dissolve it. So if you're doing 150, what we're going to do then would be go into another powder vial.
Right, so you would take this and then you would put it into the next vial, and then next vial, and the next vial if you need more. Yeah.
Depending on your dose.
Right.
Now, I do have some air in here. This is empty, so we've got the diluted LH in here. We're going to remove this big needle because this is only for mixing.
So remember this is key, guys, because I have actually had people use the same needle and forget. Yeah. And they use a mixing needle to inject. Yeah. Oops. Yeah. I mean, not so fun.
It's not fun, but it's still not wrong. Some clinics will actually do intramuscular injections for these still.
Okay, fine. Yuck. Yeah. But anyway, the point is, but you can save yourself some pain and aggravation if you're using a smaller needle, right?
Very true.
Just remember to...
So what we're going to do is unscrew. So the needles, they all screw on, screw off. Dispose of your needle. And then what you're going to get in your supplies are small subcutaneous needles. Yeah. And these ones screw on as well. At this point, you want to remove your air.
The bubbles, yeah.
Any bubbles.
And tell people why.
So I'm probably not the best person to say why. I will say why. You don't want to end up with a pulmonary embolus, too much air. However, it takes an awful lot to cause any issues. So sometimes, I don't know if you'll be able to see this on camera, but there is, see that tiny little bubble right there? Don't fixate on that. See that one there? Don't fixate on that.
Right.
If you have like this much air, don't inject with that.
Yes, right.
However, you want to make sure that you try and get all the air out of it. If you're fiddling too much with your needle and your syringe trying to get the air out, you're going to lose a lot of the medication.
Right.
And there's no way of knowing from your dosing and if you fiddled with it to try and get air out how much of your actual dose you're getting. So if you're finding that you've got a few stubborn bubbles that are sitting at the bottom here,
which like I see too. Yeah. So no biggie.
No biggie, because what happens is it ends up in the dead space of the syringe and needle.
Anyway, after you inject.
Because when you push it, you'll see that it goes, like if you have this, it's going to go to the end.
Yes, of course.
And that would stick here.
Yeah.
But that's still too much. I wouldn't say inject with that. But you can always give it a few flicks and then just gently push up until you see a bubble at the tip.
Okay, so then here's another question, and people I'm sure will be thinking about this. So when you take the powder and you dissolve it in the liquid, and then you take it, draw it back into the
syringe.
You can't get 100% out.
No.
So for the type A personalities out there, and if you're like mixing and there's 3 vials involved, do we panic when we don't get every bit of liquid?
No, because there is overfill in these vials that allow for that, especially when you're mixing with the Q caps. That's when I find you're not going to get everything out of the vial.
Exactly, and I think the manufacturers will account for it and for some of the loss, right?
Yeah.
Okay, cool.
Okay, so this one being a small needle, is also a subcutaneous injection. So same technique like we did with the pen.
Yeah.
Okay.
But we're not going to do that because you already just saw.
Okay.
No, because it's mixed. Not that one.
Okay. So
I'm done.
so I'm just going to dispose of this
Yeah.
because it's the same technique. So into the tummy or the thigh, but if you're clinic or if you're more comfortable doing the tummy, same technique like before.
So wait, were we going to show this one anyway? We were.
We were.
But not with the drug. Were we going to?
I wasn't going to actually, no. I was going to do like how we did the pen.
Oh, okay,
So
fine.
just
Okay,
poke
fine.
you
We
with
can do
it,
that.
but
All right.
not actually inject.
Okay.
Yeah.
All right.
Okay.
All right. Okay. I'm not nervous at all.
Oh, this is the one also that people will complain that it stings and burns. So
Yes.
the LH, no matter what form you're using, always has a tendency to sting or burn. So depending on your own preference, you can go really slow because some people think that that helps to minimize any stinging that they have. Some people will just kind of push it as fast as they can because they think just get it over with. So it's entirely up to you.
And it doesn't matter if you go fast or slow.
It doesn't matter.
Right? And have you heard of any feedback in terms of fast or slow being more painful or less painful?
No.
Because it's the actual injecting
Yeah.
into.
Yeah.
Okay. So that's the technique we work on. All right?
Yes.
So, you know what? Just for fun, why don't you direct me and I'll do it? It's been like 1,000 years. So, because this is what happens, right? You only get to be shown once and then you're expected to do it. So, why don't I be like the true guinea pig and just do it to myself? Okay, so back to the, from my belly, we're going to go away from. So, I'm going to do this side because you did that side.
Yep.
So, I'm going to do a little pinchy, right?
Alcohol swab.
Yeah, right. I'm not nervous at all, and I do acupuncture for a living, which cracks me up, right? But totally different needling. Okay, so you tell me, like I'll be a dart, and we're gonna go directly perpendicular because I have enough fat in there. That's like the bonus. All right, 1, 2, 3. Oh wait, you know what I do actually? I'll take. I'm not trying to prolong the process, I swear. But in terms of breath, I use my breath. So I'll breathe in, and then on the exhale, I'll poke myself. Okay? So I'm gonna breathe in, and then, easy. Okay, I'm good. Mm-hmm. There we go.
Yeah.
So I don't know if you saw, but I did it more like an actual dart, as you were talking about, right? Because you have to be committed. If you're scared, or if your partner is scared and they're not so committed with it and they're afraid of hurting you, that's when I think the needle insertion isn't very good.
Yeah.
All right, well, so I'm not going to pretend to inject now.
No, but once you've got the needle in, you're going to push this part of the plunger or the syringe to inject the medication into you.
Yeah.
And then same thing, it's going to sting or burn depending on your tolerance. So you can go fast or slow pushing this. Remember, deep breaths in and out, nice and slow. And then once you can't push it anymore, that's your injection. You wait a few seconds, so 3 to 5 seconds, and then you're going to pull the needle out.
Okay, and then does it matter if, so the needle, do you push it all the way into the skin?
Yeah.
All
so
the way
you've
in.
got it directly, like as far as you can go.
Okay,
Yeah.
so you don't see the view of the needle at all. Okay, and I keep it pinched the whole time.
You can.
So
Sometimes I let go. It depends on your technique. You'll find a lot of nurses will do it quickly, and as soon as they stick, they kind of let go. Depends on body fat as well, but how you've done it is fine as well. Some people need the extra hand to push because you're holding the syringe with one, so you will let go, and then you're using the other hand to either inject with the pen or press the plunger on the syringe.
Got it. Okay.
So you can pull it out unless you want to keep that needle.
I'm just gonna walk around like this all day. Okay? You don't mind. Okay, let's go.
So you pull it out.
1, 2, 3.
There.
Oh, look.
And then
no
bleeding.
Woohoo!
So there you go. And then recapping very carefully, and then this would go into your medical waste.
Okay.
Okay.
All right, we've done 2, and now the last one, my favorite, progesterone shots, guys.
Yes. Progesterone.
Not. Okay.
So with the progesterone injections, there are a few different progesterone oil bases.
Yes.
So you can see castor being the thickest, cottonseed, sesame seed oil bases, and then you've got ethyl oleate. So a lot of the times when you're picking up your progesterone from your compounding pharmacy, they may dispense to you, or the clinic will dispense to you 3 ml syringes that look like this. You'll also get 18 gauge 1.5 inch needles. Once I take them out of the packaging, you'll see how big they are. And then if you're getting ethyl
Not
oleate,
scaring you at all, guys.
No, yeah, no. Sorry. This is the reality of the progesterone, though. If you're doing ethyl oleate, because it's like a thinner, kind of almost like your other medications consistency, almost like a water base, you can use a 25 gauge needle for that injection. So what we're going to do, I just have a vial of saline here. Okay, so it's the same consistency like ethyl oleate. But what's going to happen is that you'll get your vial of oil, peel the seal off. The vial of oil, whether it doesn't matter the oil base that it's in or if it's ethyl oleate, it's a multi-dose vial. So usually they're compounded with 10 mLs in them or 10 cc's in them. So depending on if you're doing 1 cc a day or twice a day, depending on your protocol for your luteal phase support or pregnancy support, you want to follow those instructions. So your 3 ml syringe with your 22 gauge. So for your oil bases, I just want you to get a good look at that. Your oil bases like cottonseed, castor, and sesame seed. This is the injection needle you're going to be using. What you'll use to take it out of the vial is an 18 gauge needle. So this one would screw off, screw on the pink needle. That is that one. And this is the one that you need to remember. It's only to take out the oil from the vial. Don't inject yourself with this. This is an 18 gauge. Like do you want me to poke you with that?
No, thank you.
Yeah.
And that's where I have also had some patients accidentally use this, and that's not.
And I've heard of patients doing this by accident, and I'm like, oh my God. Like it's So remember that this is only to take out the oil. So if this here is the progesterone, we're going to go clean the top with an alcohol swab. You go in, cleaning the top every time you go in because it's a multi-dose vial. Do turn it upside down, and then you're taking out, say, your 1 cc. Okay, that's going to be stored at room temperature because it's an oil base. If it is one of the oil-based ones, if you put it in the fridge, it's going to get really, what's the word?
Coagulated
thick and you won't be able to use it. So keep it at room temperature. Once you've got your oil, you're going to take off this needle here.
So when are you warming the oil in your hand? So you said
you could do it in the vial just like this for a few minutes.
And how about into warm water, not hot?
You can. I just find that once the vial is open, you want to make sure not to put the top of the, like don't put the whole vial
not
in
immersed,
warm
but
water.
like if you just stick it like a little bath.
Yeah.
Right.
And that would be fine to do. The other thing that people will do as well is take like a warm cloth in their hand and hold the syringe like that to warm it up.
Right.
Okay.
Unless you have cold hands, and that's not going to help.
Yeah.
So
just like that. You don't want to make it too hot because then it's going to actually burn as it goes in.
Good tip.
Okay, so you want to try and keep it warm, like body temperature, if that makes sense, because you're keeping it at room temperature, which is a little bit cooler than body temperature. Need to remove the big pink needle.
Yes.
Okay, so if you're doing an oil base, so castor, cottonseed, sesame seed, it's this needle here, the black needle that you got with the syringe. So 22 gauge, 1.5 inch needle. This one, because it's the consistency of ethyl oleate is like saline.
So it's smaller. Yeah.
So you could use a 25 gauge, which you see is a little bit smaller, a little bit nicer than the 22 gauge. Still as long because it's got to be intramuscular, so we need it to get into the muscle.
And so again, you're gonna like poke it all the way in.
All the way in.
Okay, and just so you guys know, it's definitely not the deeper you go in, the more you feel, because really, it's the sensory nerves on top of the skin that you feel.
Yeah.
Right.
Yeah.
So the depth doesn't matter in terms of pain. Anyway.
No, but you want to make sure that the whole needle goes in because you want to get it in the muscle.
Yeah, absolutely.
Yeah.
Okay.
Am I poking you with this one?
Well, I'm just thinking the same thing in terms of like if there are a large group of women that are now doing it on their own.
Yeah.
And I think this is the most challenging one because you kind of have to get.
Yeah.
And I love that little trick that you did. So why don't we do that, and
You're
I'll
gonna-
try to do it again.
Okay, sure.
So, and by the way, I've never done the progesterone shots on my own.
Okay.
So when I was doing IVF, guys, I had my partner do it for
Yeah.
me, just because, you know, it's a little awkward. But Melanie here showed us a lovely way of grabbing where we can, do it where we don't have to feel like we're a pretzel. So I'll try. I'll
Okay.
try.
Okay.
I'm not going to say I'm not nervous, but you know what? You guys are like sucking it up and doing it, so I'll do it for you, for the greater good.
Yeah.
Okay.
All right. So.
Okay, I'm just going to start sweating now. Okay.
So if you're doing this shot yourself, so if I was landmarking you, knowing that you're going to do your own injections, I'm just going to recap this. So
Oh,
I can
right.
put this
Should we
down.
do? Oh, I didn't bring a marker. We could have like showed people where to mark. Well, you can just show them by
Yeah.
circle.
Yeah. Yeah.
Okay.
So what I normally will do is, if you know that your partner is going to be doing your injections for you, as Mary mentioned, she had, you're going into the upper outer quadrant. So you've got all this backspace. But if you're doing your own shots, what I usually recommend is a ventral gluteal, which is the muscle that sits here. So these two muscles will actually overlap, which gives you more range to do your progesterone injections. So if I'm saying, okay, or you're telling me that you're going to be doing your own shots because your husband travels or whatever the case may be,
And
I'm
you're
gonna
on
say,
your
okay,
own.
yeah.
Yeah.
What's going to happen is you're going to take the base of your hand here and you're going to put it on your hip and you're going to make like a C. And this is where you're going to go. So when you're doing your shots, or if I was circling for you, I'd be going like this. And those of you that do yoga and Pilates and that can stretch and bend, essentially all you're doing is literally just going like right in here.
Okay. All right. So, let me think. What was I going to ask you about that? I forgot.
Okay.
Okay.
So if you're
I'm gonna do
landmarking
this-
yourself, you're going to find your hip, and sometimes this is a bit of a
So my hip like is
Yep.
here,
So the,
and then the palm of
or
my
the base of the palm of your hand,
is on the hip, and then
and then you're giving yourself a pinch right
a
there.
nice pinch.
And then what you would do?
Oh my gosh. I can't say it's like totally comfortable. It's a little awkward, but certainly it's not over here.
Yeah. So
Okay.
if you want to take the alcohol swab to
Okay.
wipe where you're going to go,
And then it's like
right in
from here?
Yep.
Anywhere here?
Yep.
Okay. Not nervous at all.
And this is just Mary poking.
All right.
So we're not actually injecting the saline into her.
So, here's another thought. Should you not have weight on this leg?
I always say to relax this leg. Yeah, so that's
exactly.
another thing.
Aha.
You've got
See?
the high heels. It's so
Okay.
yeah, you do want to relax the leg or the side that you're going to be doing the injection on.
Okay. And so I'll breathe in, and then I'm going to poke, and I'm going to be committed. So let me just practice. Okay, like that. I'm not stalling at all. Okay. Oh, no problem. There we go. And I got to go all the way
There you
up.
go. Yeah. Good job.
Okay, let's get it out
Okay.
here.
Now, once you've got it all the way in,
and then you have to
you would
like,
press the plunger to inject.
Yeah.
If you're doing an oil base, you're going to find it's a little bit slow. You're going to
Yes,
get
for sure.
resistance. If you're doing ethyl oleate, you're going to find that it goes in nice and smooth. So once you're done, you'd wait a few seconds, pull the needle out.
Okay. Should I pull?
You can pull.
Okay. And should I like let go?
I would let go just as
Okay.
you're about to pull.
Oh, whoops.
That's okay.
Oh, look at
There you
that.
go.
Oh, maybe a little
But
blood.
that's normal.
Okay.
Where's your alcohol swab? Here.
There we go.
Press. There.
All right.
Good job.
Okay.
And then you're going to recap. So carefully recap. Normally I would do this on like a flat surface. So if this was a flat surface, going like that to recap. So I'm really not touching it, and then you're pulling it down, hearing that snap to know it's
Yeah.
on securely. This is going into your medical waste bag. If your needles are not capped properly or you do not cap them, keep pressing.
Yeah.
What's going to happen is that this will actually poke through the plastic medical waste bag that you get. So if your clinic doesn't give you those nice yellow medical waste containers and you end up with one of these, just be mindful that they do need to be recapped no matter what needles, because I've seen people pull this out of their purse when they're emptying it and they poke themselves with their own needle, but it's still, a needle stick can bleed for a long time.
Absolutely. Yeah. Not great. Okay.
No.
Okay, so that was it.
That was fun. Good
for you.
I'm so...
So I did it for you guys.
I'm always impressed when people are able to do their own, like, intramuscular injections. Subcutaneous, I find, yes, some people, they just, they're just not easy giving injections to themselves, and that's completely fine. But when I actually see, because I honestly don't think I could do an intramuscular injection on myself.
Okay, so I have to tell you, I think I just said it earlier. I've never done it.
Yeah.
This was my first time, because I was like, oh, I don't know. But literally, you guys are giving me the strength to do this because I'm doing it for you.
Yeah. It always amazes me when I hear that someone is doing it themselves. And it's another thing as women, as people, what we're willing to do to have our families.
And everyone's in a different predicament, right?
Yeah.
Because like whether you're single or you as you said, your partner is traveling, or you have a partner that is like
doesn't want to do the injection,
or is like totally phobic. You're not going to want that person to do it.
Yeah.
So you have to suck it up and do it yourself, right?
Yeah.
And so I did it for you, and if I could do it, you guys can do it, because I'm literally sweating right now.
Just don't pass out.
But I'm good. And again, for those of you that don't know me, and if you've never had acupuncture is totally different. It's not like I'm injecting anything into you, and the gauge of the needles are so much smaller. So it's a very different ballgame. Mm-hmm. But then for those of you who have had needles, acupuncture is that small that you don't need to fear going for acupuncture, because it's actually relaxing. I can't say doing this is relaxing.
No. But once you build up the confidence and you're able to do them, the time that it takes to get the shots done, you'll find that as you go through your cycle, as you go through each day, whether you're doing progesterone injections or your IVF cycle, that the time that it takes you to prepare and do the shots will start to shorten, because you're getting that much more comfortable and you're easier. Like you have a better understanding of knowing, having the confidence that you're doing it in the right spot, that you've mixed it the way you're supposed to mix it. So it's something that I see people will progress, and it just ends up being as easy as it could be for somebody having to do self-injections.
Yeah. Oh, hi Sandra. Thanks for showing up. That's so true, and thank you so much for doing it and sharing so that it helps others. Aw, thank you. Nice. Yes. Yeah, maybe you can inject yourself. And, because it's the women that always get injectables. It's like, maybe the men should try to inject themselves as well, just to see what it's like.
Just like what we did today.
Just like what we did.
Saline.
Just do it like a saline and just pretend.
Just to get an idea.
Yeah, and then you can really be more empathetic to the women that go through this process. Oh, that's a new thing. Maybe we should just say that.
Find a few men that will volunteer to be poked.
Yeah, for sure. That and I always say even the staff at the fertility clinics. I think all staff should actually get injectables, so there's more empathy.
Yeah, which is true, because a lot of the times, and this is not to say anything bad about nurses. Nurses are very busy, but it's like you said in the beginning, where you get shown once how to do this. So it's kind of like if every nurse actually did an injection and thought, oh, okay. Sometimes it's not mixing the medication, it's actually kind of sucking it up, getting the courage to do that poke.
Yes.
And that's what I find is the most time consuming when it comes to, especially when you're first starting doing your injections.
Well, yeah, because psychologically you're like, oh my gosh, can I put this in? Can I poke this in? Can I poke this in? So I don't know what I was thinking, to be honest. But like I said, what does help for sure is taking the breath in, and then on the exhale, just go. And not focusing on, oh gosh, is it going to hurt? But it's like, oh, let's just get it in. Mm-hmm. Just do it.
Yeah.
Any last words? No. Okay. So go scroll down, and you can watch all my 124 posts. And go on to YouTube too if you don't want other people to see who you are, and you can subscribe there. But our post 114 talks more about what to do in preparation for
tips for doing your injections.
Absolutely. So Thank you for being with us. And please, if you haven't done so already, check out my book, Pathways to Pregnancy. And you can get the free chapter on marywong.life. Just subscribe and you'll get that free chapter on your email. So thanks so much for watching. We'll talk to you guys soon, all right? Take care. Bye for now. Thanks so much, Melanie.
Oh, you're very welcome.
I think. Oops.